In this session, I am teaching parents how to safely perform massage and gentle exercises with their baby at home. Both mom and dad are participating in the training. I demonstrate the techniques on a doll first, and then the parents take turns repeating the same movements with their baby. We begin with the leg massage. I start by demonstrating the technique and explaining how to position the hand correctly. The father repeats the technique while I guide him through the correct hand placement, rhythm, and direction of movements. I also show how to properly hold the baby's leg and how to place the foot on the table. The parent's hand should remain relaxed, while the touch is gentle and confident. When the movement is calm and steady, the baby usually relaxes and accepts the massage more easily. An important part of learning infant massage is understanding balance. Parents should try to spend approximately the same amount of time on each side of the body. For example, if we massage one leg, the other leg should receive similar attention so the body is not overloaded on one side. Next, I demonstrate how to hold the baby's leg when performing a technique that supports the strengthening of the hip joint ligaments and healthy development of the hip joint. These movements should always be performed gently and without force, so the baby remains comfortable. Then mother repeats the same movements on the other leg, adjusting the technique according to the size and needs of her baby. I explain when it's better to work with one hand and when using both hands can provide more stability and control. Safety is always an important part of the training. We discuss areas where pressure should never be applied, such as the knee joint and the back of the knee. I demonstrate how to securely hold the baby's leg so it does not slip from the hands and the movement remains controlled and safe. This training video is part of my parent education program. The program consists of two consultations. During the first consultation, we focus on massage techniques. And during the second consultation, we learn gentle exercises and movements activities that support the baby's development. During the session, we carefully observe the baby's response to the touch and movement. We watch whatever the baby relaxes, accept the massage, or shows signs of resistance. Next, I demonstrate a simple technique that helps the baby learn to roll onto the stomach. Often it is enough to gently guide the baby's leg and support the direction of movements. The baby naturally follows the motion with the shoulders and body. The parents in this session were very attentive and focused. They carefully repeated each movement and tried to follow every detail of the technique. A few weeks later, we met again, and the mother shared that she continued practicing some of the massage and exercises at home. The baby gradually became more relaxed and started to enjoy laying on the stomach more comfortably. I also demonstrate a gentle stretching technique for the arms. This is especially helpful for babies who have increased muscle tension or stiffness. Gentle stretching helps reduce resistance and allows the baby's movements to become more natural and free. After that, we move to working with the baby in the prone position. Following several massage techniques, we add gentle exercises that support muscle relaxation, strengthen the hip joint, and help develop the feet. Next, we introduce simple movements that help prepare the baby for early standing and stepping. I also demonstrate elements of reflexes walking. During the massage, I always explain the direction of movements. In general massage, movements are performed from the foot upward and from the hand upward. I always Show parents how to position their own body while performing the massage. When the parent stands comfortably and uses relaxed hands, the movements become more natural and controlled. Sometimes babies may show mild resistance because the movements are unfamiliar. Parents often worry about this, but it's important to understand that when the technique is performed correctly, massage should never cause pain. We learn how to recognize the difference between a normal reaction and true discomfort. When we move to early walking support techniques, I first demonstrate the movements myself so the parents can clearly see how to support the baby's body. It is important that the support around the baby's rib cage is secure but gentle. I also explain common mistakes that should be avoided. For example, it is important not to force the baby into a squatting position or apply excessive pressure to the joints. Movement should guide the body naturally so the joints develop safely. Over time, parents begin to better understand their baby's body and responses. They learn to feel how the baby reacts to movement and how coordination gradually improves. Of course, not everything works perfectly the first time. Learning these techniques takes patience and practice. But with consistency and gentle guidance, parents gain confidence and babies respond beautifully. If you have any question about this course or the technique shown in the video, feel free to leave them in the comments. I'll be happy to answer them. This course is now available, and you can learn these techniques step by step together with your baby at home.